Pregnant women with a new partner are at risk of something called pregnancy-induced hypertension. The most severe form of this condition is an eclamptic seizure, and it can kill. There are a long list of causes for this condition that makes it the #1 factor for maternal deaths in the Caribbean and Latin America. This according to the Pan American Health Organization, PAHO. But it's a more complicated and life-threatening condition than meets the eye. The sound of an unborn baby's heartbeat, the fetus of a mother with pregnancy-induced hypertension. That's a blood pressure reading greater than 140/90 on at least 2 occasions. Ideally, it should be less than 140/90. Anything less than 90/60 is considered low. Last year, one mother died of preeclampsia, the more advanced stage of pregnancy-induced hypertension.
Certain factors contribute to pregnancy-induced hypertension, and these factors include first-time pregnancy, obesity, women pregnant over the age of 40 years, women with multiple gestations such as twin pregnancy and triplets, and women with previously known to have diabetes and hypertension, and also women who already have children and are pregnant with a new partner. Pregnancy-induced hypertension is high blood pressure in pregnancy that occurs in pregnant women after the 20th week of pregnancy who was not hypertensive before pregnancy, and it usually goes away after giving birth. It is referred to as preeclampsia when certain organs are affected, such as the liver, the kidneys, and the brain. The hypertension can affect the mother in numerous ways, right? And these are: 1. If the blood pressure is too high, the mother can develop a stroke. If the brain is affected, then the mother can start fitting, which is called an eclamptic seizure, right? The liver can rupture, the kidneys can fail, and also bleeding can occur behind the placenta, which causes hemorrhage and death. If the placenta does not develop normally, then the baby is affected. And these include prematurity, which is delivery of the baby before 37 weeks. The baby can be reduced in size, sudden death or stillbirth can occur, and even placental abruption resulting in death.
One medical practitioner indicated that international data estimates the rate of pregnancy-induced hypertension to be 3 to 5% globally. That can translate to a 30 to 50% of cases in Tobago. As such, doctors and midwives at the Scarborough General Hospital closely monitor and test mothers and their babies with this condition, so that treatment can be administered early and prevent further complications.
Normally, we have to weigh the risk of delivering the baby, right? So if the pregnancy-induced hypertension occurs after 37 weeks, we do assessment to determine how the baby is to be delivered, right? If there are no problems, then the patient has a labor induced. If preeclampsia occurs between the weeks of 34 weeks to 36 weeks, then assessment is made to determine if the pregnancy-induced hypertension is mild or severe, right? So certain blood tests are done, and these blood tests are done on the liver, the kidneys, the blood count, the clotting factors, and the platelet count. And ultrasound is done to determine the size of the baby and if the baby is affected. Also, the urine is tested for protein as well, and blood pressure checks are done. If, for instance, the preeclampsia develops before 34 weeks, then assessment is made to determine if the risk to the mother and the baby, if the pregnancy is allowed to continue to 34 weeks or more, right? Delivery of the baby before 34 weeks puts the baby at risk of prematurity, and then the patient will then have to be transferred to Trinidad, where there are better facilities to deal with a premature baby.
The health centers also play a role in treating women with pregnancy-induced hypertension. Tobago currently boasts of having one of the highest number of health centers per capita in the region. There are over 15 of them, along with a couple outreach centers. So expectant mothers are encouraged to visit one near to them for primary care.
All pregnant women in Tobago are seen either in the health centers or at Scarborough General Antenatal Clinic. Right, the health centers do certain checks, and these include the blood pressure test and also the urine test for protein, and these check for preeclampsia. Additional tests are also done, and these tests include the blood test for diabetes, blood test for anemia or low blood counts, syphilis, HIV, blood group, and sickle cell anemia. Right? If there's a patient in a health center that seems high risk, then the doctor at the health center would write a referral for the patient to be seen at Scarborough General Antenatal Clinic.
Besides proper prenatal care at the health centers and the hospital, health professionals also pay attention to the mother and baby during delivery so that there'll be positive outcomes.
We have a nice policy here in Tobago where we think that if the patient is in an environment with people that they're familiar with, it lessens the stress and it could play a part in decreasing the blood pressure. So what we do, we encourage one family member to come in and be there with the relative. A person who has high blood pressure and is in labor, they usually will be induced. We will have to have continuous monitoring, so they will be on the machine right through. Then we will be doing their blood pressure depending on the severity. So it could be mild, moderate, or severe. Depending on the severity, we do their blood pressure 15 minutes, 30 minutes, or hourly. So it depends on the severity, right? And then we give medication as is prescribed, and we give fluids. So the midwife's role, like in labor itself, is to be there and monitor, but also encourage an environment where they're comfortable, because you don't want them in a sterile room and they're there by themselves. So encourage one family member to be there. And you also involve them or inform them of what you're going to be doing while they're in labor.
Pregnant women are also responsible for their own health. First-time mother Latoya Wachuku found out she had hypertension early in her pregnancy. She was grateful for the professional and caring service she got at the Scarborough General Hospital. She gave birth to a healthy baby girl, Chisam, mainly because she followed her doctor's advice.
You had to change your diet, obviously. So the diet would have to change to a low salt or no salt diet. So that's basically moving from all the fancy, nice tasting food to, just a little bland tasting food for the while. You have to ensure that you have adequate rest, and you have to exercise a lot. Right? You have to ensure that you take your medication in regulation to the prescription, because that is quite critical as well. In terms of working with the medical team, any changes, they usually ask any changes or challenges to let them know as soon as possible so that they could assess the situation and make any necessary decisions. So that's basically it. So you have your part to do: exercise, rest, change your diet, take your medication in regulation, and of course keep your doctors up to date with any changes that take place.
The medical team at the Scarborough General Hospital also provides new mothers with postnatal care. Its role is to ensure there are no lasting effects of the condition after delivery.
After delivery of the baby, the nurse will also monitor the blood pressure and also the pulse rate of the mother. The pediatricians are involved, where the peds will take care of the baby. If the baby is premature, then the baby will be assessed in the neonatal unit, which we have on the ward here. And even after delivery, the mommy is still placed on blood pressure medication, the antihypertensive medication. Just because that preeclampsia or pregnancy-induced hypertension, the blood pressure takes a few weeks to decrease. The postpartum phase is actually 6 weeks. So therefore, we have ward reviews where we will monitor the woman's blood pressure. She will come on the ward, and then we will do checks. If she lives close to the health center, then we'll ask her to go to the health center to do her blood pressures, and where she will have a book and log it in for us, so that when she returns to the ward to be reviewed by the doctor, we have an idea if the blood pressure is actually decreasing.
Postnatally, for a patient who has had like a vaginal delivery, we come and assess the woman's uterus, because that uterus must go back to its pre-pregnancy state. If it does not go back to the pre-pregnancy state, she has an increased risk of bleeding, right? Because the uterus when it's pregnant, it's stretched, right? And then it must come back down and cause the blood vessels to shrink, and so we assess the uterus. So it must go involuting every day, at least 1 or 2 centimeters per day, and then you will assess the woman's low care or her blood flow, and you're going to inform her, Mom, the blood on the pad should never ever go back to when you had just delivered. So you inform her and you tell her today should be less and less until you go back to your normal low care flow. You ensure that she also has good bowel and bladder care, because you want your woman, she has come to deliver here, but she must go back to her normal function after delivery.
I must admit that Dr. Wheeler and his team, they really did an excellent job. Anything I was told to do or any changes made, I was kept abreast of why it was being requested. I was given information in terms of at every stage what could happen, both negative and positive, so that you could mentally prepare yourself. So I had no issues with the team, the doctor team. In terms of the nurses, they were very helpful. When we think about maternity ward, I think they really deserve an award. I'm really impressed. I was really impressed. I'm impressed because initially I had thoughts of going abroad, so the fact that I stayed here and I got the quality treatment, I was impressed. I have nothing odd, nothing bad to say. I was really impressed.
Currently, there aren't any local studies to indicate the rate of pregnancy-induced hypertension. But personnel at the Scarborough General Hospital are working with PAHO to get the Perinatal Information System, SIP. This software will be able to provide more accurate statistics and help make pregnancies safer for all women and their babies in Tobago.